two joints, the ankle joint and the subtalar joint. The ankle joint includes two bones, the tibia and the fibula, that form a joint that allows the foot to bend up and down. This is also called the ankle joint proper or the talocrural joint. It is a synovial hinge joint. Two bones of the foot, the talus and the calcaneus, connect to make the subtalar joint that allows the foot to move side to side. The tarsal bones connect to the five long bones of the foot, the metatarsals. The bony protrusions on the side and the back of the ankle are called malleolus. The medial malleolus is on the inside of your ankle, the lateral malleolus is on the outside of your ankle, and the posterior malleolus is on the back of your ankle. The large Achilles tendon is the most important tendon for walking, running, and jumping. It attaches the calf muscles to the heel bone to allow us to push off and up on the toes. A tear or rupture to the Achilles tendon is bad news, with a long recovery. There are another 12 tendons that cross the ankle. They are responsible for movements of the ankle, foot, and toes. Some of these tendons also help support the arches of the foot. When you sprain your ankle, you have injured one of the ligaments. The most common sprain is to the anterior talofibular ligament. The calcaneofibular ligament is also one that is injured in an ankle sprain. The muscles of the foot are classified as intrinsic and extrinsic. The intrinsic muscles are located within the foot and cause movement of the toes and are the flexors, plantar flexors, extensors, dorsiflexors, abductors, and adductors of the toes. Several intrinsic muscles also help support the arches of the foot. The extrinsic muscles are located outside of the foot in the lower leg. The gastrocnemius muscle, other known as the calf, is the largest. They have long tendons that cross the ankle to attach to the bones of the foot and assist movement. Ankle sprains are a common injury that many basketball players of any playing level suffer. Primarily due to the frequent jumping these athletes are required to do. Ankle sprains most commonly occur upon landing from a jump or applying weight to the foot when it is in inverted, which means rolled in, or everted, which means rolled out, position. 95% of all ankle sprains involve the lateral ligaments, which result from weight bearing with the foot plantar flexed, which is when the foot and toes are pointed down and inverted. Ankle sprains are classified by degree of severity. Grade 1 is no loss of ankle function with minimal disruption or tearing of affected ligaments. Grade 2 is some loss of ankle function with partial disruption and tearing of affected ligaments. Or Grade 3, which is complete loss of ankle function with a complete tearing of affected ligaments. In this particular scenario, a point guard is getting ready to shoot the basketball into the hoop. The game is at the third quarter with 5 minutes and 31 seconds left. When the player goes to shoot the basketball, he jumps and lands on his ankle, causing it to be inverted. He cannot physically move after the landing and has to be escorted off the court. After an MRI was taken, it showed that it was a level 3 ankle sprain, causing him to be out of the game for 6 to 8 weeks until he can be reevaluated again.
With 8 points and 13 assists, works against Bogdanovic. No looks to Reggie Bullock for the corner gun. It doesn't go. Lance Stevenson with a rebound.
Reggie Jackson seriously hurt on the other end. He got up, tried to walk. He tried to walk, but could not put any pressure.
Ankle.
Yeah, couldn't put any pressure on that right ankle. He's in a heap right now.
Athletic trainer John Isham rushes out to tend to Reggie Jackson. He's had a brilliant game as a ball handler and point guard. Let's see what happened.
He goes up and he comes down right there and turns that ankle. Right there, my goodness.
Rolled it. This is Pistons basketball on Fox Sports Detroit, presented by Bell Tire. While we were away, John Isham, I believe that's Avery Bradley.
Flexibility Healthy strength and good balance can help prevent ankle sprains from happening. If you lack these characteristics, your doctor may suggest that you tape your ankle or wear an ankle brace when you exercise. You should always stretch before and after you exercise. Do special exercises that strengthen the muscle around your ankle. Do special exercises to improve your balance. And if you had ankle problems before, ask your doctor about taping your ankle or wearing an ankle brace. All of these are done to prevent ankle sprains. Always stretch before and after you exercise. First, face a table or wall and lean against it, with your back leg straight and your front leg bent. Lean forward with your heel back on the floor until you feel a stretch in the calf of your back leg. Hold that position for 15 to 30 seconds. Then slightly bend your leg while keeping both heels on the floor. Hold this stretch for 15 to 30 seconds. Make sure you stretch both legs once before and after exercising. Repeat each exercise 10 to 15 times and do each set of exercises 3 times a day. Get about 2 feet of heavy rubber and band or tubing, where you can get it from a sports or medical supply store, and tie it into a large loop. Sit on a chair and keep your heel on the floor and do the exercises with your foot and ankle, not your whole leg. Place one end of the loop around the leg of a heavy chair or table and loop the other end of the band over your foot. First, move your ankle out and up, keeping the band tight. Then move your ankle in and up. Remove the band from the table and hold it in your hands, keeping one end of the band looped around your foot. Press your foot down toward the floor against the resistance of the rubber band. Try to keep your heel on the floor, just like pressing on the accelerator of a pedal of a car. Heel raises can be done by standing on one foot using a chair of balance. Slowly raise your heel off the ground and then slowly lower your heel to the floor. Loop one end of the elastic band around the leg of a table and loop the other end around your ankle. Balance on the floor of the foot and slowly kick the foot with the band out in all 4 directions, front, back, left, and right. Kick forward 10 to 15 times, then kick the same number of times to the back, to the left, and to the right. For immediate treatment of an ankle sprain, an athlete should utilize the Rice method. R for rest, avoid or limit weight-bearing activities. I, ice the injured ankle for about 20 minutes every 2 hours. C, compression, wrap the ankle in an ACE bandage, starting at the toes and ending at the calf. E, elevation, raise the injured ankle above the hip. For 24 to 48 hours to minimize swelling, this should be done. An over-the-counter anti-inflammatory medication like Motrin or Aleve can be taken to help further reduce inflammation in the ankle following the injury. The athlete should seek medical attention as soon as possible if he or she isn't able to bear weight through the affected ankle. Medical attention should also be sought if swelling or pain has not improved 48 through 72 hours. Rehabilitation after an ankle sprain is crucial to maintain appropriate biomechanics throughout the lower extremity and prevent new injuries. Goals for ankle rehabilitation are focused on regaining ankle strength, joint range of motion and flexibility, proprioception, balance, agility, and sport-specific activities. These exercises can be used for ankle rehabilitation or prophylactically to maintain ankle stability and mobility throughout an athlete's season. When performing these exercises for rehabilitation purposes, it is important to remember that they should be pain-free.